All right, today we're jumping into a topic that's, well, it's complicated. It sits right at the intersection of morality, public policy, and some very real world consequences. And just to be super clear right up front, this isn't about whether sex work is right or wrong. This is a case study in how our policies actually work in the real world and who they really affect. And that really gets us to the core question for this whole explainer, one that goes way beyond this single issue. What are the actual on-the-ground results when our main tool for dealing with a social behavior is just punishment? Let's keep that question in the back of our minds as we go. Okay, so first up, a difficult conversation. And before they really get into the weeds, we need to kind of set the ground rules for how we're going to talk about this. Look, this whole thing isn't about giving a thumbs up or a thumbs down to sex work itself. Not at all. It's really about zeroing in on a specific policy, criminalization, and asking a really practical question. Does it work? Does it actually do what it says it's going to do? We're focused on the effects, not the morality. And you've got to understand the context, right? Sex work isn't some new thing. It has been around in pretty much every kind of society you can imagine, across different cultures, for centuries, under all sorts of economic and legal systems. So the big question is, if it's been this persistent for this long, what makes us think that now, all of a sudden, just punishing it is going to make it disappear? All right, section 2, the punishment instinct. And this is a really human urge, so let's dig into where that comes from.
And let's be real, for a lot of us, the gut reaction to this topic involves a level of discomfort. You know, that instinct to do something to stop potential harm, to protect people from exploitation. That's completely understandable. And it comes from a really good place. Those concerns are absolutely valid.
So this is where it gets really interesting, right? The goal, I think we can all agree on the goal, reduce harm, protect people. But the tool we so often reach for, it's almost always criminalization. Punishment. The question is that tool actually right for this job? And this is the question, isn't it? The one we really need to sit with. If our stated intention is protection, does the method we're using, punishment, actually get us there? Okay, so section 3, when a problem hides. Let's talk about what happens. The first big unintended consequence when you lean on a punishment-first approach. I mean, the data, the research is all pretty clear on this one. When you criminalize a behavior that's this persistent, you don't actually get rid of it. It does something completely different. It just pushes it underground, out of sight. The activity moves off the streets and into private apartments. It moves online. It moves through intermediaries or pimps. And the end result isn't that it's gone, it's just that it's now way harder to see. And because of that, it's almost impossible to regulate for safety.
And this is such a critical point. The whole system of incentives gets turned on its head. When being visible is dangerous, when it could get you arrested, the system stops rewarding safety and starts rewarding secrecy. Staying hidden becomes the #1 priority. And safety? Well, that has to take a back seat.
That leads us to section 4. Who carries the risk? Because if the risk doesn't just evaporate, where does it go? Who ends up paying the price? Well, as you can probably guess, the risks don't get spread out evenly, not even close. People who have resources, money, connections, support systems, they can work more discreetly and avoid the worst of it. But people without those resources, they're forced to take bigger risks, they have fewer choices, and they're the ones who absorb all the pressure from law enforcement. It creates this vicious cycle where an arrest or a fine just makes it harder to get out, pushing them even further to the margins. And that quote right there, that's really the heart of it. The harm doesn't go away. The policy just acts like a funnel, concentrating all of that danger and risk onto the most vulnerable people in the situation, the very people the law often claims it's trying to help. Just look at this, side by side. It's a total contradiction. If you actually want to protect people, you need things like visibility, trust, and the ability to call for help without being afraid you'll be arrested. But a system based on punishment, it creates the exact opposite: fear, hiding, and huge walls between people and the help they might need, whether that's healthcare or the police. The two things are fundamentally at odds. Okay, so our final section, asking a better question. Because if the path we're on leads to all these problems, maybe, just maybe, we're starting from the wrong place. And if you're thinking, hey, this pattern sounds familiar, you're absolutely right. We've seen this play out before, most famously with drug criminalization. You have a persistent behavior, you respond with punishment, the behavior adapts and goes underground, and all the risk gets piled onto the most vulnerable. This isn't a one-off, It's a predictable outcome of this type of policy. And this is a big one. The cost to society, they don't just vanish into thin air. Nope. They just pop up somewhere else, in bigger budgets for policing, overloaded court systems, and in the ERs that have to deal with the fallout. These are the hidden, shifted costs of a policy that prioritizes punishment over public health. You see, for so long, the entire conversation has been driven by this one question. It frames the issue as a disease to be eradicated, which naturally leads you to tools like punishment. But after everything we've just looked at, is that really the most useful question we could be asking? But what if we just flip the script? What if we asked this instead? The moment you center the conversation on what actually makes people safer versus what makes them more vulnerable, the whole landscape shifts. The goal is no longer about eradication, it's about reducing harm. And all of a sudden, policies that build trust and increase access to help start to look a whole lot more logical. And that really leaves us with one final, pretty tough question to chew on. When we make these policies, what is the real goal? Is it to actually tangibly reduce harm in the world? Or is it to send a message, to signal our moral disapproval, even if that signal ends up making things more dangerous for people? The answer to that question changes everything. Now, if this has got you thinking and you want to dig deeper, believe me, there is a ton of research out there from groups like the World Health Organization and Amnesty International. You can even look at the real-world results from places like New Zealand, which completely changed its approach years ago. So, thank you for sticking with me through a really complex and, challenging topic.